So, welcome to our Wellness Bites with Gauri show. And I'm so excited that we have a wonderful guest today. And she's a wonderful health and wellness expert. So, let me introduce our guest for today, which is Dr. Vani Kotha. So, Dr. Kotha, welcome to our show today.
Thank you, Gauri. Thank you for the nice introduction, and thanks for welcoming me to the show. So it's nice to see a familiar face and talk about what I like the most.
So thank you so much, Dr. Kotha. And let me talk a little more about, what is Dr. Kotha's background and things and what she does. So Dr. Kotha has an MD FACE. She's a board certified endocrinologist in private practice in Bedford, Texas for the past 13 years. She graduated medical school from Osmania Medical College, Hyderabad with honors. She completed internal medicine residency at UMD NJ Morrisontown Memorial Hospital in New Jersey. She then completed a fellowship in endocrinology at UT Southwestern Medical Center in Dallas. She has been awarded top doctor distinction by FortWort Magazine 5 years in a row. She has extensive experience in a variety of endocrinology disorders with a special interest in diabetes management, targeting dietary and lifestyle aspects. She also has a large population with insulin pumps and continuous glucose monitoring and keeps up to date with the latest technology. She's married with two children and enjoys spending time traveling and reading books. So that's wonderful. I'm really glad to know, Dr. Kotha, that for 5 years you've been awarded the best doctor in the Fort Worth magazine. So that's absolutely great to know. So,
Thank.
Dr. Kotha, tell me more about yourself, about your story, and what made you come into this field.
Sure. So, as you have introduced, I graduated from medical school in India back in 1999. So, growing up, I was always interested in the life sciences, how things work, how living beings and living organisms function. So, it's always been an interest. And an interesting tidbit here is my grandfather, on my maternal side, he was very well versed with the naturopathy. So,
Hmm.
he was very well versed in that field. Although he was not a doctor, he used to follow all the natural cures and remedies, and he lived up to the age of 100 and with full health until he uh, died about 10 years ago. So, following his footsteps, I was always interested in health and wellness. And so, naturally, it was my inclination to become a doctor. On my father's side, my grandfather was a diabetic, and unfortunately, he succumbed to diabetes-related complications. So, when I was in medical school, I made the decision that if I were to specialize, that I would take the field of endocrinology. So, it's all the life circumstances, that drive you to a specific field. So that's what happened in my case.
Okay, that's nice to know, Dr. Kotha, that you had your grandfather was there, and that he had a lot of inclination towards naturopathy, and then you had a lot of inclination towards the life cycle and things like that. So that's wonderful to know about that as well. So tell me, Dr. Kotha, what makes Dr. Vani Kotha unique?
So, when I started practice, what I noticed is patients get more connected if you talk to them about their life and their history and their complications more than the medicine itself. So, while in medical school, we learn about the science of medicine. But when we start practicing, we see that there is more to medicine. There is the art of medicine and that art of connection and communication. So sometimes a full visit goes by just talking about the patient and their hardships and whatever they have faced is more
Mm,
important than how their control has been. So
mm,
fourth of the dialogue is gone. We're just trying to understand them. And I feel that connection is very important because then the patient starts trusting you. So
mm,
they feel that this is not a doctor who just listens to my blood sugars and my medications, writes some prescriptions and sends me home. No, this doctor is trying to understand what I am all about, and that
mm,
and communication, I feel, is really important because unfortunately diabetes is a lifelong disease, and patients want a doctor who will hold their hands for a long. So that trust and communication, I feel, is the art of medicine. And over the years, I find that that is what connects me to patients.
That's wonderful, Dr. Kotha, especially when you mentioned that the art of medicine, and that is definitely so important, and definitely so important that you connect to the patient and the patient feels comfortable talking to you and understanding that, here is somebody that who really will listen to my situation and understand what it is. So that is absolutely, I love that line that you said, the art of medicine. Absolutely. Okay. So one of the things that always keeps coming in, because again, you have a background with, you're an endocrinologist, and especially you're interested in diabetes. One of the things that always comes in is that, what is the difference between, type 1 diabetes? What's the difference between what is type 2 diabetes? Is one better than the other?
Sure. In fact, this came up with a new patient I saw just today. The patient, diabetic for 20 years, and she's on insulin. So I asked her, so you're a type 2 diabetic, and because that's what written on her chart. And she said, doc, I don't know. I'm insulin dependent. So tell me, am I type 1 or type 2? So I explained to her, and that's what I will tell you. So the basic premise is your pancreas working or not? So in a type diabetic, the pancreas is completely not working. If we were to measure peptide, which is a measure of pancreatic insulin production, it will be undetectable in type 1. Then the etiology of type 1 is mostly an autoimmune disorder. So it starts suddenly in most patients, and the pancreas, the beta cells of the pancreas which make the insulin, are completely shut off. They stop working, they're destroyed. So that makes a patient type 1 diabetic insulin dependent for life, meaning that if they don't get insulin, if they don't take insulin, they will die. So it is really a life-threatening disorder for those patients who are totally insulin dependent. Now, on the other hand, type 2 diabetes is a multifactorial disorder where there is genetics, there is lifestyle, there is obesity, the lack of exercise, multiple come together, where the pathology behind them is there is some deficiency of insulin production plus some insulin resistance, a combination. Now, as the progression of type 2 diabetes continues, there will be more and more of insulin deficiency, to the fact that after a few years, some type 2 diabetics will end up requiring insulin. But that does not make them type 1. So people think, I was on medication, I was on pills for a while, then I'm requiring insulin. Now, have I become a type 1? No, you don't become a type 1. You're still a type 2, insulin requiring type 2. And without a doubt, type 1 diabetes much more tougher to treat because there's absolutely no support from the body. Whereas in type 2 diabetics, there is some insulin production, and we can supplement with pills or insulin or a combination of the two. Whereas in type 1, because there is no support from the body, 100% of the insulin we give is what they get.
So that's very interesting to know that, because I know there's a lot of confusion, especially, with the type 1, type 2. And as you explained really well, is that, especially for people who have been on pills for a very long time, with type 2 diabetes, and when they start on insulin, suddenly they are, start getting confused that, what's happened, and is it something, something that I do that, that made me take more insulin, or was I convert to type 1? So that is really nice for the way you explain things really well. Now, the other thing, a lot of times, when people go for their annual physicals and things, and they have, go through the, they have their labs and things done. One of the things that is tested sometimes is the fasting blood sugar. So, Dr. Kotha, what is fasting blood sugar, and can stress affect blood sugars?
Sure. So, yes, when you go for an annual physical, which is recommended for all adults, their primary care doctor will order a set of labs, which are fasting labs. Fasting means typically 8 hours of fasting. So, for example, if you have your dinner and then go to bed and not eat anything from midnight onwards until 8 a.m., so that 8 hour of fasting is considered to be fasting. And the blood sugar that is then measured in the blood is called a fasting glucose. Now, According to the American Diabetes Association, a fasting glucose of less than 100 is considered to be normal. Okay, so there is a continuum here of any blood sugar between 101 to 125 is considered impaired fasting glucose. Another is pre-diabetes, it's called, loosely called, but technically it is impaired fasting glucose. And if the blood glucose is more than 126 fasting on 2 occasions, then that person will be considered to be a diabetic. Now, the second part of your question about stress, yes, stress can affect blood sugars. Now, stress is a factor where we cannot measure it. For example, if I ask, are you stressed, Gauri? And you may say, yes. How much stress? And how much stress compared to my stress? Is there a measure of blood of the stress level? There isn't. It is what objective thing, right? But there are certain life situations that bring on additional stress, job situations that bring on additional stress. And these stressors do affect cortisol production in the body, and that can indirectly affect the insulin production, insulin resistance, and that can affect your blood sugars. Yes, there is no direct measure for it, but on that, stress can affect the blood sugars.
So that is really interesting to know that, first of all, knowing about the fasting blood sugars and the levels of the fasting blood sugars, and again, what they can indicate as well. So definitely, when people do their annual physicals, it's always good to know, where they are with regards to all their, first of all, their labs and things, those markers and things. And to know that, stress does affect the blood sugars and, the cortisol effect on the blood sugars. So that is definitely great information for a lot of our viewers as well. So a lot of times people also have this question, why do I really need to manage my diabetes? So what if my blood sugars are high?
Right. You know what? This was the ideology about 50 or more years ago, that the blood sugar rise in the body is a response to the stress or illness, and it's actually trying to just show that there is stress in the body, and it's fighting off the stress. It's just a stress, that there was nothing bad about it. But then landmark trials came about, UKPDS study came about, ECT study came about, and that has shown that no, blood sugars high is not a good thing for the body. It leads to long-term complications. There are microvascular and macrovascular. So microvascular means complications to the eye, leading to retinopathy and blindness, complications to the nerve endings in the hands and the feet, resulting in numbness, and it can also lead to loss of sensation. And people actually, without that sensation in their toes and fingers, can lose their feet. They lose the complications happen. And another important microvascular complication is kidney disease and renal failure. Will end up in dialysis. In fact, the number one cause of kidney failure in America is diabetes. Macrovascular complications are heart disease, heart attacks, and strokes. So these are all very, very important implications of diabetes control. Now, diabetes itself, when the blood sugars are high, is mostly an asymptomatic disease, meaning that people don't have any symptoms. If the blood sugars are gradually going up in the blood, whether your blood sugar is 100 versus 50 versus 200 or 250, people have no symptoms at all. And unfortunately, that's the reason why many people don't take care of their diabetes, because it's not affecting them. Unless the blood sugar goes beyond 300, then they have some thirst, or they pee a lot, or they feel achy. But otherwise, for the most part, it's asymptomatic. So it's important to realize the complications and start taking control of diabetes before it becomes too late.
So that's very good to know that, with the high blood sugars, some of the long-term complications, and to understand that why it's important for people with diabetes to actually control their blood sugars pretty early in life and not wait too much until it's actually going to cause symptoms and then take care of it. So that's a very important tip for a lot of our viewers, especially with diabetes, to know why it's important to control our blood sugars right now, is to prevent those long-term complications. But then the question arises, Dr. Kotha, is that, how can people prevent diabetes?
True. So type 1 diabetes, unfortunately, is not preventable. Like I said, autoimmune disorder, actually what sets it off, we still don't understand. But when it happens, it again is a lifelong disease. We have not found a preventative treatment or cure for type 1 diabetes. Now, type 2 diabetes, like I said, it's a multifactorial disorder. There is the sedentary lifestyle, unfortunately, weight gain, there's stress, there is high carb diet, Western lifestyle, so to speak, and then the genetics. So if there is a family history of diabetes, it can predispose you to develop diabetes. Now, among all these risk factors that I mentioned, the genetics is something that we cannot change, but the rest, sedentary lifestyle, the weight gain, diet, stress, these are all preventative factors, right? So in a way, you can tell that for the most part, if you pay attention to all these preventable or modifiable risk factors, you can prevent developing diabetes. So if you have a family history of diabetes, you know, if you follow these principles and start working on diet and exercise and lifestyle care, then we cannot say 100%, but there is a big chance that you will not develop diabetes.
So that is good to know that, you know, especially with the modifiable and non-modifiable risk factors, that, you know, the modifiable risk factors are more. That means we can work on those modifiable risk factors and definitely prevent, you know, with diabetes. That's absolutely great to know. So question I have is, you know, when it comes to diabetes as well, is one ethnic group more susceptible to diabetes compared to the other? Because there are a lot of these studies and things around. So what is your take on that?
Sure, definitely. That's where the genetic factors come into picture, right? So unfortunately, Asian population, Southeast Asian population, a huge genetic burden of diabetes. So that is why we see that more and more of our Southeast Asian population are developing diabetes, because the genetics is something that we cannot modify. On top of that, these modifiable risk factors are adding up, they're piling up with the Western lifestyle, high carb food, lack of activity, more stress with our work and our culture. So all these are adding up on top of that, making them at a higher risk. In fact, Indian population, Southeast Asian population is at one of the highest risk factors among other ethnicities to develop diabetes. Same thing we can talk about the Mexican population here, you know, also at higher risk for diabetes. So because of the Native American genes in them. So these are the ethnic groups that are at higher risk compared to the Caucasian population.
So that's, you know, that's good to know about, you know, the risk factors and things as well. One of the questions I definitely have for you, Dr. Kotha, is, you know, what is, you know, I know that you are a busy endocrinologist, you're a busy doctor and things. And for you yourself, what is a fitness routine or a fitness, you know, what is your fitness mantra that you follow for yourself?
Okay. For a long time, I did not have any fixed routine or schedule. I was just busy, you know, a working mom like you, running after the kids. And pretty much that was what was enough to keep me going. But as we all age, unfortunately, the metabolism catches to us, right? So it slows down and it makes us pause, think, and force us to develop a good lifestyle. And so for the last few years, what I have done consciously is to have an exercise routine every day. So for at least 30 to 40 minutes, I take it somewhere from my life, you know, in the morning or in the evening, whenever it's possible, 30 to 45 minutes of cardio activity. I clock in about 10,000 steps a day. Okay, that is definitely a big thing. Recently, I've also started doing some ab exercises. Okay, so activity part of it. Second thing is diet. So I'm a vegetarian since childhood. So I have, because now that can be a drawback, because it the protein content can be sometimes tough to incorporate in a vegetarian. So what I have done is consciously tried to cut down on the carbs, incorporate more plant-based protein and vegetables in my diet, and down on the snacking also. So these. Now, I've always been very good about sleep. Sleep hygiene, I feel, is very important, because sleep is a very restorative and reparative process in our body. No matter how busy we are, if we sleep well, when we get up, we are refreshed. So I think that it's a learning process. Like I said, for a while you ignore because you're busy, or you think you don't have time, but I think life teaches you some lessons, and you just have to incorporate certain healthy routines into your life.
Hmm. That's very interesting to know, Dr. Kotha, that one that you're pretty active. You're trying to get at least 10,000 steps a day. Then you talked about sleep, which is definitely one of the important, what I call important pillars of our health. And the third important thing you talked about, the diet. You focus a lot on plant-based proteins and things, and you make sure they have enough vegetables and things in the diet. So definitely, you definitely touched base on the important routine, important things when it comes to the health and wellness as well. So, Dr. Kotha, what tips do you have for our viewers today?
For wellness generally,
Yes, for wellness.
yeah, I would say, follow these three pillars of lifestyle. There is the physical health, there
Hmm.
is the emotional health, there is the mental health, and general wellness. And you have to put yourself out there in the center, put yourself front of your priority list, because more often than not, women, we put ourselves in the back burner, and that doesn't help us or our family, right? We have to put our health and our wellness in the center, incorporate whatever routine is suitable for
Hmm.
your and your family, but definitely some kind of activity every day, whatever is. You can slowly ramp it up at your convenience, but
Hmm.
definitely incorporate some kind of exercise in your lifestyle, because it is not a part of our daily activity because of the kind of lives we live, right?
Hmm.
Working is, we hardly walk at our work anymore, so unless we incorporate the activity, it's not there. So
Hmm.
definitely that. And whatever the kind of diet you are, a vegetarian or non-vegetarian, try to please cut down on the fats and the carbs,
Hmm.
incorporate vegetables and protein.
Hmm.
And for snacking, which can be a problem, and for most of us, try to do
Hmm.
vegetables, fruits,
Hmm.
seeds, nuts,
Hmm.
unprocessed snacking. That will cut away a lot of the fats that we eat. And
Hmm.
definitely sleep is an
Hmm.
important. I always emphasize for all my patients also, incorporate a good sleep routine. Finally, if you are into any kind of relaxation, whether it
Hmm.
be meditation or yoga, relaxation, whatever it is, it need not be
Hmm.
religious, need not be any particular thing, but have some downtime. Have some
Hmm.
downtime yourself, and that will help yourself heal and do well.
Hmm.
So it's an all round kind of a.
Absolutely, Dr. Kotha. You really touched on everything, every important aspect today, with the health and wellness tips, when it comes to, taking care of ourselves, your activity, our diet and things. So definitely, all the important aspects you definitely cover really well with our wellness tips and things as well. So, Dr. Kotha,
I'm
do
sorry.
you, yeah, go ahead.
I want to add something here is, don't fall trap for any shortcuts,
Hmm.
because health is not a shortcut journey. It's a journey for life. If you make some dietary modifications, lifestyle modifications, make sure that you incorporate something that you like, and that you can do for the rest of your life. If
Hmm.
that not, for example, if somebody wants to do a zero carb or a keto diet,
Hmm.
that is long term sustainable. You cut
Hmm.
you cut down on the fats, you eat more protein, eat more healthy food, but don't completely stop a health group, a food group
Hmm.
from diet. That is not sustainable. Same thing, if you want to suddenly start running a marathon, I mean, you can do that if you haven't done that before. So
Hmm.
slowly and make it sustainable, and don't fall trap for shortcuts. Health is not a shortcut. Somebody say you can lose 20 pounds in 20 days. Please don't do that. It's not good for you. So,
That is definitely a good one, Dr. Kotha. I mean, I definitely will say that this is really important, to understand that we have not gained this weight in one day. It's not coming off in one day as well.
that,
So that is definitely very nice of you to say that, when especially that, that health is not a shortcut. So we have to give a lot of importance to our health, make
Mhm.
it equally important. In fact, I say that making that our highest priority is our
Right.
health and wellness, because if our health and wellness is well sustained, we can see ourselves well sustained in long term as well.
Totally.
Okay. So, Dr. Kotha, do you have any update or any events and things that are coming up from your, from your practice and things that viewers should know about?
So I have been in private practice for the last 13 years. So since I finished my fellowship in 2007, I've been practicing at the same location in Bedford, Gauri. So I've been at the same place. And 5 years ago, I have added a partner to my practice. So we are a two-physician practice. With COVID, we have also incorporated televisits to
Hmm.
maintain distancing and still keep the continuity of care intact. But we always welcome new patients into our practice. As you have rightly mentioned in my introduction, I am really passionate about diabetes. Unfortunately, diabetes and obesity epidemic is
Hmm.
is getting out of bounds, especially living in this obesity nation of Texas, right? So we
Hmm.
see of insulin resistance and diabetes, and everyone has a role to play to prevent further uncontrolled diabetes from happening. So I try to keep abreast with the latest in diabetes technology, insulin pumps, continuous glucose monitors, the combination control IQ pumps. So I keep myself abreast with all of that. But at the same time, also know at the backbone of this is the diet and exercise. So
Hmm.
we just not continue to embrace the latest without falling back on the backbone of the
Hmm.
diabetes control, which is the diet and exercise. So I try to do an all-round
Hmm.
patient. So that's our motto in our office as well.
Okay, wonderful, Dr. Kotha. That is absolutely great to know that you have implemented telehealth and things as well. I know with the current situations, it's definitely a plus to know with patients, especially with diabetes. Sometimes we see that the immunity factor coming in as well, and to know that you have that availability so that patients feel comfortable with that as
Right.
well. That's absolutely great. So how do patients contact you, Dr. Kotha?
So my office is in Bedford. It is right across the HEB hospital. And our office phone number is 817-786-8686. You can call any business day when our office is open to make an appointment. Like I said, we always welcome new patients. And I always tell people when they try to contact me, I said, I hope you don't get to see me. I hope you don't need to see me. But if you need to see me, we are there.
Okay, okay. So thank you, Dr. Kotha. I mean, it was wonderful chatting with you today, discussing diabetes management. And you put it, put light on a lot of different aspects, especially, what's the difference between type 1 and type 2 diabetes, what is the stress effect as well. You talked about, the important pillars of, health, and, you gave wonderful wellness tips as well. So thank you so much for coming on our show today. And again, giving us a lot of information with diabetes management. And I hope that our viewers today did learn something and got a lot of valuable information as well. So if you have any questions, or for example, or if you have any family members and who would like to take a consult with Dr. Kotha, make sure to contact her. And thank you again for being on our show. And we hope that our viewers again give us some recommendations regarding any other experts you would like to have us on this show as well, and as well what are the different topics and things that you would like to learn more about. So again, you can always send us an email, or you can give us a call. And again, thanks a lot for listening to our show. Keep tuning and keep listening to Wellness Bites with Gauri. Thanks a lot. Bye bye.
Thanks, Gauri. And thank you for inviting me to the show. I have also listened to some of your podcasts and saw some of your broadcasts about healthy tips, wellness bites, recipes. I've seen some of the good vegetarian. So keep going and keep rocking. And to all your viewers, I would say stay safe and stay healthy.
Okay, thank you so much. Thank you so much, Dr. Kotha. It is always a pleasure to always talk to you and again get inspired.
Same here, Gauri. Take care.
Okay, bye bye.
Bye.